you're not too young to have a stroke. We are not too young to have a stroke.
Hey besties! We're back for another fun-filled, wonderful episode. And this month is Heart Health Month. So in honor of that, we're wearing our red, blinging it out, you know. And so we decided to dedicate this webisode to Go Red for Women.
Let's be honest. I mean, we're young, we're vibrant. We can't have heart disease, right?
No, of course not.
Right. False. Yes, we can.
Your heart pumps to all the organs. You need it for pretty much every part of your body. I mean, when you're in spin class, getting it in, or, you know, at the club, trying to get it in. Yeah, your heart needs to pump for that. Or when it melts, when you see the birth of your new child, or when you see the love of your life and your heart skips a beat, or when he makes you mad and your heart is on fire. So we have to have more appreciation for all the wonderful things that our heart does.
The biggest misconception that we hear out there is that women don't get heart disease, and they also don't get strokes or heart failure, but that's just not true. Cardiovascular disease is killing 1 in 3 women. So that's a woman a minute that dies from one of these diseases. It's just out of control, and we need to do our part to make sure to get that number down. Even in our 20s and 30s and 40s, we can still be affected by heart disease.
So this is for you, our young, fabulously fierce besties.
Stay tuned. Strokes, just like heart attacks, are not only a disease of the old. It's not only old men who are smoking and have high cholesterol and have diabetes and uncontrolled blood pressure. Those are not the only types of people that have strokes. Yes, these risk factors are important and they do cause a large majority of the strokes, but there are always exceptions, and unfortunately, we young women often fall in the exception category. So there are basically 2 types of stroke. The first is from a clogged blood vessel, and the second is from a ruptured blood vessel. With the type of stroke that's caused from a blocked blood vessel, that is called an ischemic stroke. It's when the blood vessels get clogged with fatty deposits. The other type of stroke is from a ruptured blood vessel, which is called a hemorrhagic stroke. This occurs when the walls of the blood vessels get very weak over time and eventually rupture. Although they have different mechanisms, both of these still cause the same effect. The brain does not get the oxygen and blood supply that it needs, and it begins to die quickly. So let's talk about some of the less common causes of stroke that affect young besties like ourselves. So the first one is having an abnormal rhythm of the heart. You may have heard words like atrial fibrillation. These are basically rhythms of the heart that predispose you to blood clots, and those blood clots can travel as the heart pumps blood to the rest of your body. And eventually these blood clots that form in the heart can travel to the brain. Another well-known risk factor for a young woman having a stroke is being on birth control. So we're not saying this to scare you, because we know a lot of you out there are on birth control, but those hormones can have an effect on your blood and cause you to clot, especially if you have risk factors for stroke in the family. Pregnancy is another risk factor for stroke. What happens during pregnancy is that you're actually in something that's called a procoagulation state. So your blood likes to form clots. So it doesn't affect every woman by any means, but some women are more predisposed to getting the clots than others. So in addition to getting clots in the brain, which is a stroke, they can also get clots in other parts of their body called a deep vein thrombosis. Unfortunately, even after you deliver, your risk for stroke is not only present, but it's also higher. For the first 6 weeks after you deliver the baby, your body has an increased risk of having a stroke. And doctors think this is because of the change in hormone levels from the pregnant state to the non-pregnant state. So you've heard us talk a lot about autoimmune diseases, and there's one in particular called lupus, which definitely predisposes you to strokes. It also still has to do with the coagulation of the blood and how the blood likes to form blood clots. So just like how you can have blood clots in the rest of your body, having lupus can also put you at risk for having a blood clot in the brain. This last one is pretty rare, but we do see it every once in a while. You can actually have a dissection, which is a ripping of the blood vessel in your neck after trauma. We've seen these cases in patients who have been in car accidents or other kind of trauma where there's rapid movement of the head and the neck. Patients who have gone to the chiropractor's office or have gotten a massage of their neck. And really any trauma to the neck can cause these blood vessels to rip in the neck and will lead to a stroke. So we have a great diagram in medicine that's called FAST, F-A-S-T. Each letter stands for an important sign and symptom to look for, as well as an action that you should do if you see any of these. First is the F, and this is for face. You may have an uneven smile or have numbness or tingling on one side of your face. The next one is A for arm, which means that your arm could feel weak. You could drop things or you can have numbness or tingling in the arm, but keep in mind you can have these symptoms in the legs as well. The next one is S for speech. So this is slurred speech, meaning your speech doesn't sound very clear, but keep in mind you could also have difficulty finding words or saying the wrong words when asked a question. And lastly, T is the most important. In medicine, we say time is brain. So the sooner you can get to the emergency room if you have any concerning symptoms, the better. The longer you wait, potentially the more areas of the brain that will get decreased blood flow.